In the last video, we talked about fighting predators you can see. These ones you can't. There is a roughly 40% chance that a parasite is living inside your body right now. Not a metaphor, not a bacterium. An organism with its own life cycle, its own reproductive strategy, and its own agenda. And that agenda does not include your well-being. Some of them are harmless, some of them are manageable, and one of them eats your brain in about 2 weeks with a fatality rate that rounds to 100%. 6 parasites. Starting with Toxoplasma gondii, the one the internet calls the cat parasite. Except there's nothing funny about a protozoan that currently lives inside roughly 2 billion human brains and may be quietly adjusting what those brains decide to do. Toxoplasma needs a cat to sexually reproduce. That is its biological endgame, and it will use your brain as a waiting room to get there. You pick it up from gardening, unwashed vegetables, undercooked meat, or changing a litter box without washing your hands. Once inside you, it crosses the intestinal wall, enters the bloodstream, and migrates to your brain and muscle tissue. It forms cysts. And then, it waits. Most healthy adults never notice. The immune system walls off the cysts, and Toxoplasma sits dormant, possibly for the rest of your life. But here's where it gets measurable. In rats, Toxoplasma rewires the fear response. Infected rats lose their fear of cats. They become attracted to the smell of cat urine, which, if you're a rat, is the biological equivalent of walking toward a loaded gun and smiling. This is not accidental. Toxoplasma needs to get back into a cat to reproduce, so it turns its host into a delivery vehicle. The question is whether it does the same thing to humans. Studies have linked Toxoplasma seropositivity to increased risk-taking behavior, slower reaction times, higher rates of traffic accidents, and associations with schizophrenia and bipolar disorder. The research is not conclusive, but it is extensive, and 2 billion people are carrying it. Imagine a slight pressure behind your eyelid, a faint itch you can't reach. That's not Toxoplasma, that's Loa loa, the African eyeworm. It enters through the bite of a deer fly, travels through your subcutaneous tissue for years, and occasionally, visibly, crosses the surface of your eyeball. You can watch it move. So can your doctor. Diagnosis is often made because the patient walks in and says there is a worm in their eye, and they are correct. Loa loa affects an estimated 10 to 13 million people in Central and West Africa. It can live in your body for up to 17 years. Treatment exists, but killing the worms too quickly triggers a dangerous inflammatory response. The cure can be worse than the parasite if you have too many of them. You walk barefoot on contaminated soil. The hookworm larva penetrates the skin of your foot. You won't feel it. It enters your bloodstream, travels to your lungs, gets coughed up, swallowed, and arrives in your small intestine, where it attaches to the wall and feeds on your blood. One hookworm drinks about 1/3 of a milliliter per day. That sounds negligible until you consider that a moderate infection involves dozens of worms, and a severe one involves hundreds. Chronic hookworm infection is one of the leading causes of iron deficiency anemia in the developing world. Between 576 and 740 million people are currently infected. Most of them are children. That is roughly 1 in every 10 people on Earth, walking around right now with something attached to their intestinal wall, drinking their blood, and they don't know it. They might feel tired. They might feel slightly short of breath. They might assume they need more sleep. They don't need more sleep. They need a deworming tablet. 30 feet. That's how long Diphyllobothrium latum can grow inside your intestines. It doesn't drink your blood. It eats your food. You get it from raw or undercooked freshwater fish. The worm attaches to your gut wall and absorbs nutrients from every meal that passes through. Most people don't realize they're infected until they see segments of the worm in their stool. Each segment can contain thousands of eggs. The worm can live inside you for 25 years. Treatment is a single dose of medication. The problem is that most doctors in developed countries don't routinely test for it, and the symptoms, fatigue, weight loss, abdominal discomfort, are the kind of symptoms you'd blame on stress. Mr. Grimm found a case study on this one from a hospital in Finland. The patient came in complaining of chronic fatigue. The diagnosis took 3 months. The worm had been eating his lunch for over a decade. The medical report described it as an incidental finding during a routine colonoscopy. Incidental. A 10-foot parasite. Incidental. Guinea worm doesn't hide, it exits. Dracunculus medinensis enters through contaminated drinking water. The larvae mature inside your body over about a year, growing up to 3 feet long. When the female worm is ready to release her eggs, she migrates to the surface of your skin, usually your leg or foot, and creates a blister. The blister burns. Instinctively, you put your leg in water. The worm senses the water and releases hundreds of thousands of larvae. The blister ruptures and the worm begins to emerge, slowly, over days to weeks. The traditional extraction method has not changed in centuries. Wrap the emerging worm around a stick and turn it a few millimeters each day. Pull too fast and the worm breaks. A broken worm inside the body causes severe infection, sometimes fatal. The only way to get it out is patience. In 1986, roughly 3.5 million cases per year. As of 2025, low double digits. Guinea worm survived millennia. It couldn't survive education and water filters. And then there's the one that should keep you out of warm lakes, Naegleria fowleri. It lives in warm, fresh water, lakes, rivers, hot springs, poorly maintained swimming pools, and occasionally tap water in warm climates. It cannot infect you through drinking. It can only infect you through the nose. If contaminated water goes up your nasal passage, the amoeba travels along the olfactory nerves directly into your brain. It reaches the frontal lobes and begins feeding on brain tissue. The first symptoms appear within 1 to 12 days. Headache, fever, nausea, stiff neck. These are the same symptoms as a dozen other conditions, which is one reason Naegleria is almost always diagnosed too late. Within days, the infection progresses to confusion, seizures, hallucinations, and coma. Between 1962 and 2023, 157 cases were reported in the United States. 153 were fatal. 4 people survived. That is a fatality rate above 97%. There is no reliable treatment. The few survivors received aggressive experimental therapy within hours of symptom onset, before most patients even know what they have. The standard advice is to avoid swimming in warm, fresh water, especially in southern states during summer. Use nose clips or keep your head above water. But Naegleria has also been found in tap water systems. In 2011, 2 people in Louisiana died from infections linked to their home water supply. They were using neti pots to rinse their sinuses with tap water that contained an organism capable of dissolving their brain. Your doctor assumes you're clean. Standard blood panels assume you're clean. The entire medical system runs on the comfortable assumption that parasites are a developing world problem. That assumption is statistically wrong. You have to specifically ask for targeted parasite testing, and most physicians in developed countries have never ordered one. Comfortable assumptions in medicine tend to last right up until you feel a tickle behind your eyelid. But parasites aren't the scariest thing that can trap a human mind. There's something else, something that doesn't need a host, doesn't need water, and doesn't need a vector. It just needs 4 walls. Sunday.